In my film project, I will be studying Dory from the movie Finding Dory, which was released in 2016 by Pixar Studios. The film is primarily set in the ocean and various marine environments along the California coast. The main character, Dory, a regal blue tankfish, is known for suffering from short-term memory loss, which leads her into forgetting things quickly. Despite this forgetfulness, though, she's a cheerful personality and unwavering positivity. The film itself, being an animated film and intended for a family-friendly audience, has a more vibrant and joyful tone when telling the story of Dory's journey of attempting to find her long-lost parents. Now, let's take a look at the condition Dory suffers from. In the film, Dory has the inability to retain new information from recent events, which can be classified as short-term memory loss, which falls under one of the main symptoms of anterograde amnesia. Anterograde amnesia can be defined as a type of memory loss when a patron has the inability to remember new information after a point of trauma. This also includes having the inability to transfer information to the short-term memory to the long-term memory of the brain. Two notable symptoms of anterograde amnesia that Dory has includes having the difficulty to remember new information in her disorientation, which consists of Dory often finding herself lost or confused around her surroundings. In the film, one noticeable example of Dory's symptoms occurs when she is at the Marine Life Institute and becomes separated from Marlin and Nemo. Dory finds herself in the quarantine area, a place filled with various tanks and medical equipment used to treat injured sea creatures. As she swims around, trying to find her way, Dory gets confused and starts to panic. She doesn't recognize where she is or remember how she got there, and she's unfamiliar with the surroundings, which adds on to her disorientation. This moment highlights her struggle with anterograde amnesia as she forgets the purpose of her journey and her location, leading to anxiety and confusion. One other symptom that Dory has is fragmented memories, shown in this clip right here.
Dory! Dory!
Mommy? It was my fault.
One symptom I didn't find too noticeable in the film was her emotional memory retention. Though she's able to recognize important individuals to her, such as Nemo and Marlin, who are the two orange fish in this clip right here, I don't think this symptom stands out too much as compared to some of the other symptoms shown in the film. Overall, anterograde amnesia has a huge impact on our personal, social, and professional lives. Anterograde amnesia impacts our personal life by compromising the ability to learn new skills and by making us struggle to remember recent conversations, recent tasks, which ultimately makes everyday activities challenging. Anterograde amnesia impacts our social life by making social activities challenging due to the fact that people diagnosed with anterograde amnesia have the inability to recall recent conversations, and also makes our social life hard by making it difficult to maintain relationships, such as relationships with friends and peers. Finally, it affects our workplace life / our personal life by making it difficult to be advanced in our career. It also hinders certain job tasks by creating misunderstandings in the workplace relationships due to constantly not being able to recall important information. My treatment plan for Dory does not completely revolve around the use of medications. Though there's no actual cure for it, here's one way you can treat anterograde amnesia that I will be using on Dory with the purpose of improving the quality of her life. Weekly, Dory will be attending 3 types of therapy, which include cognitive rehabilitation, which is a structured program to improve memory skills and coping mechanisms. Occupational therapy, which helps an individual adapt to the memory limitations in daily life. And also psychotherapy, which is supportive therapy to help with the emotional impact of amnesia and to develop strategies for managing the condition. Though these types of therapy don't fully treat anterograde amnesia, they can help in improving the quality of life, and this is necessary because anterograde amnesia is not yet able to be fully cured for. However, some ethical concerns with this treatment plan may lead to exhaustion and the emotional impact that comes with amnesia. However, this treatment plan is ethical because it has the purpose of improving Dory's life and has the intention to teach the patient coping mechanisms to counter any emotional impact as well as memory learning skills. And one huge barrier that definitely hinders the character from receiving this treatment is the fact that this character is a fish and not a human. Like, It's just that simple. Like, fish can't receive treatment. However, a few stigmas in our culture for someone with anterograde amnesia include social isolation, meaning that due to difficulties in social scenarios, the ability to hold on to friends may lead to loneliness. And this also leads to distrust and frustration from others and family, and as well as perceived happiness, which means that one with this disorder might feel completely helpless knowing that this disorder can't be fully cured for, which has a huge negative emotional impact on them. Ultimately, this film does a good job in not only portraying anterograde amnesia and Dory, but gives us awareness about it, and it also shows what it's like in social situations too. Anterograde amnesia can be diagnosed in all cultures. However, the approach and understanding of it may be different, such as the symptom reporting may be different in some cultures, healthcare and access might be different in some cultures, as well as understanding mental health may be different too in other cultures. And also, I believe that Dory, if Dory went to a therapist in the film, the diagnosis would be the same because the film is set in the USA in California. Overall, I think Dory portrays an accurate example of what anterograde amnesia looks like because of the way she is in social situations and in the situations and areas around her in the film. Her reputation of forgetting recent events significantly supports a good portrayal of anterograde amnesia.